Recording in progress.
Hi, everybody. This is Ginger. Thanks for joining us. I'm just gonna get a few things going here. I see Dr. O'Hora has joined us. Thank you for joining us, Dr. O'Hora. I'm just making sure I have given everybody recording permission. Looks like I have. If I've missed you, please just send me a chat. Okay. Just make sure I've given permission. Bear with me. Okay, Dr. O'Horrell, are you ready?
Yep, I'm ready. If you can hear me, I'm ready.
Yep, I can hear you just fine, thanks. I'm gonna get rid of that chime. Okay. All right, so the way we sort of position this is just sort of an opportunity for journalists to ask you whatever they're needing to know for their daily coverage today. So I did get a few questions ahead of time. Let's start with those. So why don't you just give us like current state? What's the current state of COVID-19 and the variants?
So the current state of COVID-19 and the variant spread is we're still seeing Delta as the primary cause of most cases in this country. And with that, higher rates of transmission and infection than we've seen with prior variants. This hasn't been accompanied with the same degree of spikes in hospitalizations, in no small part due to the effective vaccines and masking in some areas. And that's one of the key takeaways, is that although we're in a fourth wave of this, the vaccine effectiveness is going to make this less severe for the hospitalizations than prior waves, even though the acuity and the burden of it immediately is substantial.
Okay, what demographic is being most affected and infected by the Delta variant at this time?
So right now with the Delta variant, we're seeing that this is infecting younger people than some of the previous variants have. It's not entirely clear if that's because this variant is really more infectious to the younger people, or more likely because we've vaccinated a large number of older people, so the most susceptible tend to be younger. But what we are seeing is that being young is no protection against getting COVID-19 with this Delta variant, particularly for those who are too young to get vaccinated.
Okay. What's the most crucial thing we need to do to help bring down that infection rate?
So there's two crucial things that we all need to be doing to bring down this infection rate. One of them is getting vaccinated if you haven't yet. The vaccine remains one of the most potent tools we have to bring this back under control. And even though people who are vaccinated can still get infected and can still potentially transmit to others, they do that at a far lower rate and are far, far less likely to end up hospitalized or having a complication from COVID-19. The other thing is masking, and the CDC has provided ample guidance on masking. And at Mayo Clinic, we've been doing masking in our patient care and non-patient care areas. But looking at areas where there's high transmission, the combined effect of masking and vaccination do more to reduce transmission than any one measure alone.
All right, awesome. And speaking of masks, can you talk a little bit about the best type of mask? Like, what about neck gaiters? Those.
So the best type of mask remains like whatever kind of mask you can wear consistently and properly. And that means to say that any kind of mask that really is covering your nose and your mouth completely is going to be a good mask. There is still some debate about the role of things like neck gaiters, but I am far less concerned about seeing somebody wear a neck gaiter than I am about seeing somebody who has a proper surgical mask that's wearing it below their nose or below their chin. A good source control mask is really just one that can cover your face appropriately.
All right, excellent. Okay, can you talk? I've heard a lot about breakthrough cases. Is it common? Why is it happening? And what does it mean about the vaccines?
So breakthrough cases can refer to a couple of things here. Most commonly, it's being used to refer to somebody who has an infection with COVID-19 despite being vaccinated. I think that is a definition that's a little bit overly broad, because many of the people who are vaccinated have little to no symptoms, and we're only finding out about this because we're doing testing before procedures or testing before travel. So that ends up making it sound like the vaccines aren't necessarily working as well as they should. What the vaccines were really built for, and what they do quite admirably, is reduce the incidence of severe disease, meaning those who get hospitalized. We are seeing some breakthrough hospitalizations where someone's vaccinated and still get severe disease. In most of these cases, the disease probably would still be worse if they hadn't been vaccinated in the first place. But we're also seeing that these breakthrough hospitalizations tend to happen in people who we'd expect to have weaker immune systems and might not have the same lasting protection from the vaccine. So people who have immune compromise, the extremes of age, those kinds of issues are likely leading to a decreased vaccine efficacy, which is part of why there's been some more guidance about being cautious if you're immune compromised. In all likelihood, that means that you were vaccinated earlier on in the course, so your vaccine has had more time to wear off in an immune system that's more likely to have it wear off sooner.
Thank you. That's really helpful. Okay, now I'm going to go to the questions that I got in the chat here. This comes from Jeremy. COVID-19 deaths have not increased in Minnesota this month, even after infections and hospitalizations have increased. Well, this doesn't fit with national trends and it might be too soon to tell. I'm wondering if there is any reason why COVID deaths might not be increasing as substantially in this wave compared to other prior COVID waves.
So likely the main reason that deaths are not accelerating the way they were with prior waves, particularly in Minnesota, is the effect of vaccination. Minnesota enjoys a relatively high rate of vaccination, and we're seeing that areas that have higher rates of vaccination do have lower rates of mortality. Now, we still may be relatively early in this in Minnesota. The Delta variant did seem to hit the southern United States and some of the lower vaccinated areas first, and it's really may not have hit, it hasn't hit its peak here yet, but we're still going to be seeing some significant mitigation from the effect of that vaccine.
All right, thank you. This comes from Alexander. Can you talk about what we know about the frequency of different types of symptoms among A, vaccinated breakthrough infections compared to unvaccinated cases, and B, how Delta compares to Alpha?
Sure. So in terms of the symptoms that we see that are different between vaccinated versus unvaccinated individuals, the symptoms really remain the same. We're still looking at initially cold type symptoms like cough and fever, and in people who have more severe infections, pneumonia type infections, symptoms, where you get more shortness of breath and worsening cough. The difference is that if you're vaccinated, you're more likely to have milder versions or none of those symptoms as opposed to somebody who is unvaccinated. So vaccination reduces the symptoms, but it doesn't necessarily change them. In terms of differences in symptoms between Alpha and Delta variants, although some differences have been noted in the way it transmits and the speed on which it onset, it does seem to have a shorter incubation period. The actual symptoms themselves have not been noted to be drastically different.
All right, thank you. All right, this comes from Jonathan. Does the treatment differ according to age group? Do the types of complications you see vary according to age?
So age is certainly a risk factor that dictates some of the complications that you may have. It's one of many risk factors, such as immune status and other health conditions. And all of these go into decisions about treatment. But the most important thing that goes into the decision is how sick somebody is when they first show up and when we see them, which is to say, are they having trouble breathing and how bad are their symptoms in the first place? And for all of these things, this comes back to that point of vaccination. Those symptoms are much less severe in vaccinated people on average. And that is the single most protective thing that somebody can do to avoid complications of COVID-19.
All right, thank you. This comes from Catherine. When you say young, are you seeing more children in the hospital with severe illness, or are you referring to younger adults?
So I am a internist. I am a physician for adults. I cannot give any sort of numbers on what they're seeing in the pediatric side, but in the adult population, we're certainly starting to skew younger.
So younger adults, okay. This comes from Caroline. Are the variant tests done on the population level or on the individual patient level? That is, how are the prevalence of these variants being correlated to the age of patients who are more vulnerable?
So a lot of the variant testing is being done on individual specimens that are being sent to state and our own labs for sequencing to try to identify this. But at this point, we know from the samples done by public health authorities that the Delta variant is really predominant throughout the United States, and the epidemiology and spread is fairly consistent with this throughout the U.S.
All right, thank you. This comes from Liliana. Do you have any idea what the next trend might be in the next couple of, or what the trend might be in the next couple of weeks? There have been some massive concerts and events in some states. And also, what should we expect in the fall or winter?
Certainly. So as we look to the next few weeks here, the Delta variant surge is far from behind us and is likely to continue to accelerate, particularly in communities with lower rates of vaccination. What we've seen in other countries is that Delta seems to hit fast and hard, so that this peak will probably come in the next several weeks, and then we'll see a period of rapid decline. Going into the winter, it'll be difficult to predict exactly what's going to happen at this point. But our best chance of avoiding another wave and having a more normal winter is for as many people as possible to get vaccinated. Depending on where you are, getting a vaccine now may be a little bit late for the current wave, but there's still benefit of it because this doesn't have to be the last wave, but it could be with enough vaccination.
Right. Okay. Thank you. This comes from Sarah. How would you like to see journalists frame stories about breakthrough cases among the fully vaccinated? What degree of attention do you think the public should pay to these cases? That's a great question.
That is a very good question. And I think that the right way to frame this is that the primary thing to consider in breakthrough infection is what's happening to the patient. Are they being hospitalized or having complications from COVID-19? And so the hospitalizations and death trends are really the headline here when it comes to, is the vaccine working? The fact that many people with the vaccine can be infected and transmit without showing symptoms is important when we talk about measures to reduce transmission, but that really shouldn't cover up the efficacy of this in reducing severe infection and complications.
Okay. This question comes from Jeremy, makes me smile. If you were running the Minnesota State Fair, would you keep it open, and what COVID protections would you require to be put in place?
So when we look at what the measures that are being put in place for any kind of event here, the general guidance that's being given by state and local public health authorities has always been fairly consistent about trying to maintain masking where appropriate. And I'm going to harp again on the role of vaccines here. Again, it may be a little late for this fair, but when we look towards any other kind of gatherings that are going to take place in the early fall, the more people who are vaccinated, the less severe the risk will be for these kinds of events.
Excellent. Okay. All right. This comes from Sarah. What can we expect with the Delta variant and the school year starting? Could this cause more waves since vaccines have not been approved for younger children younger than 12?
So the school year starting is happening at an unfortunate time relative to this Delta wave right now. And schools across the country are having to grapple with what is going to be the most effective way to try to mitigate the risk for in-person learning. I look forward to seeing the day when these vaccines become available to school-age kids, so we have that, and look towards the local public health authorities to come up with the appropriate guidance for that for each area based on their local transmission risk.
Any updates on the timing for that younger population?
I wish I had inside information on that. I have a 3-year-old in my house myself who I'm anxious to get vaccinated. But I know the same as probably anybody else who watches the news, which is it's anticipated soon, but what exactly soon means is a matter of interpretation.
Right, exactly. Okay, let's see, I'm just making sure I haven't missed anything. Do you have any insights on boosters? There's a lot of talk about boosters.
Yes, this is something that some countries like Israel have moved towards a booster strategy based on some preliminary data from the companies involved. Is something that we're likely to see increasing discussion of boosters and hopefully some guidance about this, particularly for those immune compromised people I talked about earlier on who we're starting to see more breakthroughs in. We don't yet have enough data to know if that is going to be the preferred route or how effective a third shot of the same vaccine will be versus some of the new boosters that are under development by these companies. But at the same time, it is clear that there are some higher risk groups and some guidance is expected soon on that.
All right, thank you. This question from Catherine. Can you speak to why it appears the FDA is taking its time giving EUA to the vaccines for kids under 12? Is this process dramatically different from how they are tested in adults? Does it hamper public health messaging around getting young kids vaccinated if the FDA moves too fast?
So I can't speak to what's taking them more time with this than was originally anticipated at the beginning of summer. I don't have any special insights into that, but I can say that the FDA is a very thorough organization when it comes to making these determinations, and that's part of how we're so sure of the safety of these vaccines in adults, and I'm sure they want to lend the same credence to these vaccines in children.
Thank you. This from Liliana. What pre-existing medical conditions reduce the efficacy of the vaccine the most? With the breakthrough cases of those who die, is there a specific medical condition that they had in common?
So when we look at where these breakthroughs that get hospitalized come from, they do fit into a few categories, all of which seem to point to having a weakened immune system, such as people who are transplant patients who are on active chemotherapy and a few related illnesses. We haven't yet been able to rank what the relative risk is of all these. Fortunately, these are rare enough that it's going to take a little bit of time to actually study them methodically and get enough of them to say where trends really exist. But that's the trend that currently is out there.
Thank you. This comes from Caroline. There's been talk that the vaccination can accelerate the emergence of variants that can get around the current vaccines. Is there any evidence that might be happening? And is the U.S. doing surveillance of new emerging variants?
So the U.S. continues to do monitoring of new and emerging variants, and there is ample international attention on the variants of concern throughout the world. But when it comes to what effect vaccines have on variants, every time that somebody gets infected, that presents an opportunity for a variant to emerge. So the more people get vaccinated, the fewer opportunities there will be for a mutation to develop into a new variant. So enough people getting vaccinated isn't going to select for these variants, new variants to develop. It'll actually suppress the opportunities that they have to develop.
All right. Thank you. And I'm just seeing in my email that I got some questions from Matt here. So I'm going to ask these all together. What makes the Delta variant different from early COVID?
So the main thing that makes the Delta variant different from earlier strains is that it seems to be more infective. It is a little bit stickier, so to speak, with that spike protein. So it takes fewer viruses to cause that initial infection. And once it's there, it divides more rapidly and creates a faster course of disease. This doesn't transmit fundamentally any differently, but it does mean that there's less room for error when it comes to some of our other protective measures, especially in settings where we deal with people who are unvaccinated or immune compromised, like in the hospital.
What do we know about the efficacy of the current vaccines against the Delta variant? Is it more or less effective against Delta?
So the effectiveness of the vaccines depends heavily on what outcome you're looking at. And the main outcome is the hospitalizations and death, and the existing vaccines remain highly effective against that. Where most of the discussion of reduced efficacy and some of the low numbers come from is cases where we're seeing these people who are infected but don't know it because they have an asymptomatic infection. That is more common with Delta than with prior variants, but that's not really a failure of the vaccine. It just is an indication of how much we can trust the vaccine to keep others safe on its own in a time of high transmission.
Okay, thank you. We were told earlier that COVID was like the flu for children, that it posed less danger to children. Are children more at risk of severe symptoms and hospitalization from Delta?
I'll have to defer that question. I would like to, that's something that I would want a pediatrician to answer so I can give the most up-to-date possible information on that. I'm sorry.
That's okay. So Matt, I will see if I can get an answer for you on that and email you back. And lastly from Matt, if the vaccines still provide protection for people from the Delta variant, why are they being asked to mask up indoors? If the answer is about protecting the unvaccinated, why shouldn't they own up to the consequences of their own action?
So in terms of the first part of this, the risk is the risk you have of infecting somebody who's not only unvaccinated, but somebody who may be incompletely vaccinated or have a less than ideal response. We know that no vaccine is 100% effective. So even if you are vaccinated, you have a drastically reduced but still real risk of having disease. If you're in an area of high transmission, that's where we're asking vaccinated people to mask, because you're more likely to have an asymptomatic infection and transmit it to others. In terms of the question about whether this is we're at the point where this is a decision to not get vaccinated would be a decision to live with those kinds of consequences. I would say that looking to all of the people who haven't had an opportunity to get vaccinated, such as children, and all of the people whose vaccines may not have taken as effectively, like the immune compromise, give me significant concern about that, as well as there are people who have legitimate reasons why they can't take the vaccine, like those who had an allergic reaction to components of it.
So we're protecting them.
We're protecting them, and and the fewer exposures we get, the less likely we are to get this, because it is not 100% effective, and you don't want to find out you're in the one of those rare individuals who could still get COVID-19. You can do everything you can with the vaccine, but multiple layers of protection are warranted in these times of high transmission.
Got it. Okay, thank you. Back to the chat. This is from Jeremy. Lots of talk about vaccines, understandably, but what about treatment? Have there been any improvements this spring or summer in the clinical or hospital care of COVID, or which treatments to use and when?
So there has been a steady advance in the overall treatment and approach to COVID-19 infection therapies. We've had this become more protocolized over time as we understand what works and know things like steroids and a anti-inflammatory called tocilizumab appear to have some significant benefits. And some of the prior treatments that we've had have fallen out of favor or are used a little bit less frequently. But probably the most important impact that we have on treatment now versus at the peak of the pandemic is when hospital systems aren't stressed to their breaking point, we can provide the best possible supportive care, which is probably the most important thing. When your nurses and your doctors are overworked and can't provide the same careful attention to a patient on the ventilator, that has a negative impact on their care. And this is one of the many positive effects of vaccination, is that reduced rate of hospitalization allows for higher quality care.
Excellent. Okay. This comes from Sarah. Do you have any insight about the possibility of long-haul COVID in breakthrough cases of fully vaccinated people?
So the question of long COVID and fully vaccinated people is something that I'd say is still open to analysis and discussion. There's every reason to believe that this would be less likely, as every other complication of COVID appears less likely if you're vaccinated. But this isn't something that I'm aware of being extensively studied to the point that we can make any conclusions about that. So it probably prevents it, but not definitely.
Okay. Thank you. This comes from Maureen. Do you see an off-ramp for masking, given that COVID is likely to become an endemic respiratory virus? Meaning, will we ever get out of masking?
I think that masking in public areas is going to be a relatively short-term thing for this surge of the Delta variant. The guidance offered by the CDC and others has tied the need for masking for vaccinated individuals to local transmission, which is likely to follow that fall that we saw in other countries. Now, it is likely to become endemic, which does mean that in areas where you're working with people who are immune compromised or are unable to be vaccinated or have weakened immune systems, like healthcare settings, we're likely going to need to have different precautions and mask longer, which is similar to what we saw earlier this year when there was unmasking was allowed for vaccinated persons on May 13th, but it continued in healthcare settings for exactly that reason. I anticipate that that's the sort of thing that we'll see again, is longer masking in some settings than others. That's driven in part by occupational and population needs and in part by local transmission trends.
Gotcha. Okay, questions in the chat have kind of slowed down, and we have a little less than 20 minutes. So I would invite journalists, if you'd like, You're welcome to unmute yourselves and speak to Dr. Ohoro directly if you prefer that, or you can continue putting your questions in the chat.
Hi, I have a question. Can you hear me?
Yes.
Yep.
Hi, I'm Sarah here in Rochester. I have two questions for you. The first one is, what's kind of your thoughts on businesses mandating vaccines for their employees?
So when it comes to vaccines, I can speak to what we've been doing here at Mayo specifically. We have a mandatory participation program where we are requiring employees to either get vaccinated, or if they have a medical contraindication or strongly held religious or personal belief, to go through some mandatory education to opt out of vaccination. This is similar to the process used for other types of things at other institutions, and should drive the rates of vaccination up, which is really what we want to see. We've seen, since that program was announced, a rate of employee vaccinations on a daily basis has more than doubled.
Okay. And then my second question is there concern about more kids catching COVID these days now?
So children and their risk of COVID, this is going to be one of those questions that perhaps Ginger could put you in touch with the pediatric infectious disease specialist about, to give a more detailed answer on. But we are, as I said, seeing that this is really a higher risk for unvaccinated individuals, and children are one of our largest pools of unvaccinated persons.
Okay. All right. Thank you very much.
Dr. Ohoro, this is Catherine Richert with Minnesota Public Radio. I just want to go back to the relatively new requirement that Mayo has for their staff to get vaccinated. Do you have any sense of what types of people waited this long? Like, are we talking about nursing staff, physicians? Like, who are the employees at Mayo who have waited for that mandate to be put in place to get vaccinated?
So I do know that among our frontline providers, there was a lot more initial uptake of the vaccine, which I don't think is any surprise. People who have been coming into contact with COVID regularly and seeing what it can do in hospitalized patients are opting in higher proportions to get vaccinated earlier than most. Beyond that, I don't have a lot of insight into any specific roles that are lagging behind. But some of our survey data on this question indicated that the reasons for hesitancy are the same as really the general population. Namely, some concerns about safety is one of the large ones, and perceptions that the vaccine process may have been approved too quickly. Concerns about how this is under an emergency use authorization rather than an approval, and some other concerns about very specific side effects. So when we go into our opt-out process, we try to address some of those specific concerns through education, as the vaccines really are quite safe despite the seemingly rapid approval process that they went through. And there are a number of misconceptions about the safety and side effects that we can specifically address and try to encourage people to get vaccinated and feel comfortable with that choice.
And I just want to make sure I heard you correctly earlier. You said that since the requirement was announced, you've seen staff vaccination rates double by the day. Is that correct?
The number of vaccines being administered daily have doubled since what we saw from the beginning of summer through most of July, and then they doubled when we announced that. Yes.
Okay. Okay. Got it.
Hi, this is Jeremy. If I can ask a question. I've read a lot of stories from around the country of doctors encountering patients who are dying or going on the ventilator, wishing that they had been vaccinated and it's too late. I'm just taking a flyer here. I'm wondering if you've encountered that personally, and if you can talk about any such encounters you've had like that.
So that's not something that I can speak to personally. All of the COVID patients that I have seen personally on the ventilator were already on the ventilator by the point that I saw them. So they had no point for any kind of discussions like that. I just can say that I hope to see fewer patients on the ventilator with increased vaccination rates.
Well, and as a follow-up, I'd wondered, despite best efforts, you must have encountered a lot of patients who've lost over the past year and a half. How are you doing? Has it been difficult?
This has been a very trying time for many people in healthcare, myself included, just because of the sheer volume of cases that we've seen and the amount of human tragedy that's associated with that. But we're at a point where there's some light at the end of the tunnel here. We have a tool that works to get out of that, and that gives me and many other providers hope that we can look to a better future on this.
All right, thank you. Hey, a couple quick questions in the chat here I don't want to miss. This comes from Sarah. Seeing what New York has been doing with vaccination status and there being more restrictions based on vaccination status, how do you think this will affect people getting vaccinated across the country? Such as, will it make people feel like they're being forced to be vaccinated?
So I think that there are going to be an increasing number of activities where we see some kind of restriction based on vaccination. And this comes back to the more people get vaccinated, the more that life will be able to return to normal, especially after this Delta variant where even vaccinated people have to get masks. In terms of the desirability of that, I would prefer that people opt into vaccination themselves. That's why we're making extensive efforts on education around some of the misconceptions and reasons that people may be hesitant on this, because the preferable thing is for people to really feel comfortable with the choice to get vaccinated as the right thing and safe thing to do.
Thank you. And this one also in the chat from Caroline. Is there any possibility of achieving zero COVID, or will we be looking at annual waves of new variants similar to the flu?
So I don't think that zero COVID is something that we are going to see. I think we are going to see COVID get suppressed to the level that with adequate vaccination rates, it's manageable in most environments. Again, with some environments needing some sort of continued screening or precautions. I think that we're going to be looking at seeing some version of a booster shot in the near future, but it's hard to predict exactly what that will look like. Given the transmission we're seeing, though, I think that this has more to do with protecting from hospitalization and severe complications, much like we do with the flu. And that's going to be the name of the game for vaccinations in the future, too.
All right, thank you. All right, I think we have everything in the chat. So if anyone else wanted to just unmute and ask questions, that's fine.
Dr. Matt Stolley from the Rochester Post-Bulletin. I just wanted, you kind of ended on an optimistic note, and I wanted to ask a downer question, because it seems like our plans for normalcy are always upended with these new emerging variants, and this is a very opportunistic disease, and it seems like, when these new variants come out, there's some more infectious and potentially more dangerous. What is your concern that there's going to be another variant coming out that's going to even be worse?
So when we look at what can we do to reduce the odds that we're going to have a variant that drives us back into needing masking and other measures like we have right now, the more people we see vaccinated, the less of an opportunity there will be for these kinds of variants to emerge. I think that we have ample monitoring at this point, and we'll have to remain vigilant as a society for new variants that do require additional measures and to require additional vaccines. But at this point in time, the real thing to take away from this is that vaccines are a way to prevent complications. They're a strategy to reduce the susceptibility of communities to and individuals to these variants. I do not think it's a coincidence that we saw these variants come to the Northeast and the Midwest, where we have some of the higher vaccination rates, a lot later than they came to the southern states, where we saw the initial higher rates of that. So protect your community and protect yourself against those future variants. Get the vaccine. I'll try to turn that downer into a positive takeaway.
All right, excellent. One more in the chat here from Maureen. With the understanding that people shouldn't go out and seek a breakthrough infection, can those who have had them think of it as essentially a free booster shot, bolstering their vaccine-induced immunity? Does it work that way?
So that is a interesting question. From an immune standpoint, there may be some validity to saying that having a circulating asymptomatic infection may provide some ongoing boost to immunity and suppress more severe infection. As you said, people shouldn't go out and seek that kind of a thing, because you never know if you're going to be that individual who gets a more severe breakthrough infection. But on a population level, there is some reason to think that that having a low virulent circulating variant may have some benefit for keeping vaccine-induced immunity strong.
All right, thank you. Anyone else? Questions?
I have a quick follow-up to my question about the about businesses mandating vaccines for employees. Is that a good thing, a bad thing? Is that kind of like maybe a bit more, I can't think of the right word, but taboo, or, not necessarily a good legal thing to do, or, just kind of looking at, why is this necessary for businesses to do?
So in terms of mandates for vaccines, what really is important is any kind of strategy that helps improve vaccination rates is desirable at this point. Whether the vaccine mandates are going to be the most effective way to do that has a lot to do with local and specific business trends. Like we've seen this take off in healthcare with moves towards things like mandatory participation in Mayo Clinic, where I think there's a stronger culture towards that kind of a thing. I am not in a position to say if a mandate is a one-size-fits-all solution. This is something that's going to have ample consideration from specific local ones, but any strategy that really helps overcome vaccine hesitancy is a positive for getting things back to normal.
Okay, thank you very much.
Liliana with Univision here. Within our Hispanic community, we're still seeing a lot of skepticism about the virus. One question that I received last week was, if the Delta variant is so bad, why are kids back in school? Why are there concerts? Why are we open back to normal? And I had a tough time answering that question. I guess, how can you lead us into answering those questions for our viewers? And how can we better inform them about what's going on and why they should be worried?
So I think that the main driver for a lot of this is that we all really want things to be normal again. And that is a very understandable thing. This has been more than a year, and everyone, myself included, wants to return to a more normal life. And that does mean that people are doing some of these gatherings and such, and I would advise that people who are doing that really have to take into account local conditions, because it may or may not be safe to do this depending on what your local rates of transmission do. And then individuals, of course, have to take into account their own risk by, are they doing masking and vaccinating on top of whatever other measures are being recommended. So just because people are going out and doing these things now doesn't necessarily mean that it's advisable. But this all is depends on what your local transmission patterns look like.
Doctor, just one last question. Given that children are potentially more susceptible to this, and if you were in a position of power with the schools opening in the fall, what would you recommend? That the schools open or that they go distance learning?
So this would be a question I would honestly, and I'm going to try to give you a partial answer to say why I would defer this one to a pediatrician, is that distance learning does come with its own risks and costs that go with this. And not being somebody who's a specialist in child education, I don't feel qualified to weigh those risks versus benefits. I do think schools need to take into account all of the mitigation if they do in-person learning, as I think most are doing. They do have to consider what is the best way to ensure safety for their teachers and their students when they do so.
All right, one more question in the chat from Caroline. Are the waves of infection generally tracking with mitigation efforts like vaccination rates, masking, businesses closing, etc.? Or does seasonality or regional temperatures play a role?
So the waves of the Delta have definitely correlated with the rates of local vaccination in terms of when they arrive and how severe the hospitalizations have been. Mitigation patterns like masking also did show a strong correlation with previous waves where they were more extensively studied. The role of seasonality is one that was seen last year, but the fact that this is currently being seen as a spike in August has somewhat upended that. There is a role of temperature, seasonality, and people being outdoors, but it appears that with Delta, the increased transmissibility overcome some of that.
Right. Thank you.
Can I jump in with one more question?
Yeah, go ahead, Jeremy.
I wondered about, it's been a contradiction almost between the very low rates of breakthrough infections being reported in Minnesota, like 0.1 or 0.2% of fully vaccinated people are suffering breakthrough infections. And then you have something like Provincetown, Massachusetts, and the report from the CDC where like 2/3 of the people that they discovered in that outbreak had breakthrough infections. And I have a hard time reconciling that contradiction. I guess I'm wondering what you make of that and what, the real breakthrough risk is.
Yeah, so I think what Provincetown demonstrated is that the breakthrough infection potential for vaccinated persons is clearly there. However, in the about 500 people there, I think it was only 4 who ended up hospitalized and none ended up dying from the infection, which is really getting to what we understand about the complications rates and the severity of breakthrough infections. And although it's perhaps a little bit worse than what's been observed elsewhere, it's not so far out of the realm of possibility that I'd say that Provincetown may just end up being statistically a slightly worse than average outlier compared to what we're seeing more generally.
All right, thank you. All right, we have just a minute or 2 left. I would make last call for questions. And also, Dr. O'Horo, if there's any closing thoughts you want to share, please go ahead.
We'll give a second for a question to pop up.
Nothing so far.
I'll just reiterate again that at this point, although we're looking at a rough few weeks ahead with the Delta surge here and the need to return to some of the public health measures we saw in the last year, like masking and so forth, depending on local transmission, with the vaccine, we really do have light at the end of this particular tunnel and are closer to the end of this pandemic than the beginning.
Excellent perspective. I really appreciate your time, Dr. O'Horo. Thank you. I know you're a busy guy. If you have follow-up questions, journalists, just shoot us an email, newsbureau@mayo.edu. I do have a recording of this if yours was faulty. We'd be happy to share that. And with that, thank you everyone for joining us. And thanks again, Dr. O'Horo.
Thank you.